The abdominal curl up exercise is a very important exercise as we want all of your patients to understand how to truly perform a true abdominal sit-up. When most people perform sit-ups, they're normally utilizing overactive hip flexor muscles, and we want to teach them how to truly use the abdomen. In this position, we will be utilizing the floor unit, the Pro Series stability ball, resistance tubing with the handles, and we will have Courtney get into position to perform this exercise right now. You want nice support in the mid-thoracic region, and you want her to perform very slow concentric eccentric movement patterns as she does abdominal curl-ups. We want her to focus on utilizing the muscles in the abdomen and leave these lower extremities very relaxed. I love this next exercise. The squat exercise is so important as so many of your patients have weakness in the quadricep muscles and they cannot perform a true squat. We will be utilizing the floor unit today, stability trainers, and of course the resistance tubing with the bar that Courtney has on her shoulders. Utilizing the stability trainers really ramps up the complexity of this exercise, and it's so important to help these people, once again, with core strength, balance, proprioception, and stability. As Courtney performs this exercise, we want to make sure she has a neutral spine, nice lordosis in the lumbar spine. She's looking straight ahead. She's breathing as she performs the exercises, and she's going down in a very slow, consistent movement pattern. This next exercise is the hip abduction or abduction exercise. It is so important as many of your patients have true weaknesses in the gluteus medius musculature, and we want to incorporate this movement. It is also a very weak muscle when performing lower cross syndrome and evaluations with functional testing procedures. With this movement, we will be utilizing the wall unit. The wall unit, of course, goes up to 7 feet high, and thankfully with this unit, it goes down almost to the floor. We're also utilizing an ankle strap and resistance tubing. As Courtney performs the exercise, we want her performing looking straight ahead without having to rotate the pelvis or the hips as she performs this exercise. Once again, very nice, slow, consistent movement patterns. During this next exercise, Courtney will be performing rowing exercises. This is important as we can stabilize the scapular musculature that is so weak in so many of your patient base. What we will begin utilizing is the floor unit and the stability ball. With the Pro Series ball on the floor unit, this will allow her to have a little bit more balance and of course give her proprioceptive feedback during this procedure. We're also utilizing the horizontal bar, which has multiple attachments and therefore allows us to do bilateral movements. At this time, I'm going to ask Courtney to perform a nice slow rowing exercise, utilizing the muscles between her scapular borders. As you can see, very short, slow, consistent movement patterns once again. Have the patient sit up straight, correct posture as she has, with abdominal bracing throughout this exercise. The next exercise will focus on scapular retraction. This will focus on the mid to lower traps and the scapular stabilizers. We will be utilizing the horizontal bar with multiple attachments and of course resistance tubing with the hand straps. As this exercise starts, we'll have our arms fully extended with some resistance in the bands, and what I'm going to ask Courtney to do is now get into a flex position as she goes back, working the posterior delts and the mid to lower traps. This is a fantastic exercise for the stability in the scapular stabilizers.